note in from somebody who says, I wonder if you're aware that there's discontent amongst the medical consultants who've been deprived by the closure of the private wing at Nobles because the previous management was envious of the additional income they were earning. We've lost good doctors, and the health authority is now having to pay substantial sums to locums to complement the services. This to me is a waste of taxpayers' money. Would it not be better to have happy consultants who can give continuous medical treatment to NHS patients instead of having locums who don't know their patients well and charge exorbitant fees for their services? If nothing's done urgently about the situation, more and more highly qualified doctors are going to leave the Isle of Man. So there's a shortage because people left.
Right, well, there's something I need to clarify there. In relation to consultants, actually, there's only one consultant that resigned over the changes to the private wing, which made the media at the time. There's been no one else that has left over that. And in fact, in terms of consultant posts, we are actually recruiting into consultant level posts at a higher rate than the department ever has in the past. In fact, we've recently filled some vacancies that had remained vacant for years. In terms of the private wing,
replacements.
Yeah, permanent replacements. So it's not a case with the private wing that it's shut, it's gone. There are consultants that are concerned because obviously private practice is an additional thing on the side, and it does help with lists as well for people who want to go private. But what we were offering as a private wing was not, let's be honest, a private patient's offering. Its actual name was a ward number of the hospital. What we are doing is we are revamping the private patients wing. We will be going out to partner with a third-party provider, so it will be completely separate, and when it's back up and running, it will be giving a 21st century private patients offering, not just a side room which people are paying for.
What's the timetable on that?
So it's in programme for government for delivery in June next year, and we're about to go out to the third-party providers for we've already had expressions of interest, but we'll be going out formally now the public consultation is finished on what people want from the service.
And being optimistic, when would the doors open to
so
a
again,
new private wing?
That's the June 2020 deadline
June 20.
in the programme for government. When I announced the closure, it was an 18-month closure, and that takes us to June next year.
Recruitment at Southlands, how's that going?
Recruitment at Southlands, I believe there is recruitment underway. Again, it can be a struggle sometimes to fill the vacancies, but from the information I've had, it's been positive.
And provision of nursing homes in general, obviously the population, this is a problem that the Western world has. We have a time bomb coming down the line because the baby boomers, after the Second World War, the baby boom was 1945 to 1965, and those people are approaching, and certainly some are in retirement age, and they're living longer.
They are, and that's why it was one of the main focuses of the Sir Jonathan Michael review about getting more provision in the community. That is one of the things I'm very keen on as Minister, because what we've seen in the past is we've run what I would call a very old-fashioned health service, everything focused around the acute side and the hospital. Now, obviously, the hospital has its place, it always will, because there's always people that are going to require hospital treatment. But at the moment, the hospital for many people is the first point of call, not the last. And what we need to do, as Sir Jonathan said in his health review, is start divesting services out of acute into the community where you can do preventative measures. Because let's be honest, by the time someone presents in hospital, whatever's wrong with them has already happened. It's a reactionary service, not a preventative service, and we need to move towards prevention, because as the demographic does age, there will be more and more demand on services, and it's important that we try to mitigate that as much as possible.
Now, also, I'm trying to think of a better term, but that's a rather distasteful term, bed blockers. There are elderly people who are in hospital because there's nowhere else for them to go.
Yeah, I mean, I agree. I don't like the term at all, bed blockers, because it suggests that someone's there because they want to be there. People most certainly don't. One of the things we've actually done in the last year, one of the achievements, is what's happened with Ramsey Cottage Hospital, where there's a step-down service now up in Ramsey. So instead of people staying in Nobles and being forced to stay there, they can be transferred up to Ramsey now, which has got more on a focus on getting them right, finding a place for them to go, so they can either get a form of respite and step down. So we have actually managed to remove a lot of the sort of people who are stuck in Nobles with nowhere to go now.
Salisbury Street home, is that full?
Salisbury Street, as far as I'm aware, yes, it is at the moment. I believe that all the beds that we block book as DHSC are taken up.
So that's a publicly owned property, but run by a private company.
So the building is actually publicly owned. It's rented out to the company, and it is a private nursing home. But we have a block of NHS rate beds that we purchase off the company.
And the new one that's going to be opened in the old civil defence, building, that's 73 beds, I think it's going to be.
Yes, I believe so, yes.
And will that be a private one as well?
It will be a private one. Again, whether we go down one of the things I'm very keen to do is sort of look at the Salisbury model and try and expand that. I don't think you should get government into the purvey of running their own nursing care homes. I don't think that would be very realistic, to be honest, and I think that's something better done by the private sector. But where we can engage and what we can do is exactly what we've done with the Salisbury Street model, where we block book beds at an NHS rate.